Hey, Margie here. Did you know that by making some changes to your lifestyle, you can dramatically improve your health? Well, today we're delving into lifestyle medicine with our very special guest, Dr. Rob Downey. And Dr. Rob is a functional medicine physician who's been trained in family medicine. And he works at Seaworthy Functional Medicine Clinic in Alaska. Lucky Dr. Rob. And Dr. Rob has been practicing functional medicine since 2006 when he saw that he could really help his patients with a combination of whole foods, probiotics, supplements, and lifestyle. And so today we're going to talk about the importance of lifestyle medicine and what tweaks we can do to really improve our health. Dr. Rob also talks about some functional medicine testing he uses with osteoporosis, osteopenia, as well as gut testing that can really benefit everyone. So this interview is packed with takeaways for all. So stay tuned. Welcome, Dr. Rob. I am really excited to have you here on the podcast. You bring so much to the table, and I enjoyed being on your podcast, and now I'm so happy to have you with our audience. So thank you for coming.
Good morning. Thanks for having me. I'm excited too.
And you're coming from Alaska, I can't even get, it's so amazing how technology can work, how here it's afternoon in New Jersey and here it's morning in Alaska. But before we get started, it must be nice there. I have never been to Alaska, and certainly one of the places that is definitely on my to-go list.
This photo behind me, I took that when I was out running with my wife the other morning. So that's how that backdrop emerged. Yeah.
It's gorgeous. It's so beautiful. I'm ready to fly on the plane if I could and get right there. Anyway, why don't we start? Because I think your story is so interesting, because here you were a doctor working emergency medicine, not emergency medicine, I guess family medicine, and then you switched over to functional medicine. So why don't you tell us what caused that shift and sort of how you got to where you are today with what you're doing?
I was at an integrative clinic in Montana when I got back from Alaska my first time. So I had practiced for 2 years north of the Arctic Circle in Kotzebue, Alaska from 2000 until 2002. And that was right out of residency. So up north of the Arctic Circle, I delivered babies. I was in the ER. I was admitting patients. I was doing everything. And then I wanted to get back to my home state of Montana, and so I was working in the Bitterroot Valley, and an integrative clinic needed a doctor, so I ended up employed at an integrative clinic out of them being receptive to me being there and vice versa, but I didn't have training in integrative medicine. So this naturopathic doctor who became my mentor, Hillary Daly, trained at Bastyr, she helped a case of autoimmunity with stress management, whole food, probiotics, some botanical anti-inflammatories, boswellia, bromelain, quercetin. And the amount of improvement, about 50% improvement within 3 months, was 100-fold the amount of improvement that person had had on medication at about 1/100th the cost.
Wow.
And at that juncture, I just had to have that toolbox, and I never looked back. I got training from IFM and did more and more and more functional medicine all the time. And then when I got to Alaska, I transitioned to knowing that to try to attain mastery level in functional medicine, I would need to be doing it full time. So all of the folks I've collaborated with in business, I've always said, this is my main contribution to making clinical medicine. And so for a number of years now, that's all I do every day.
That's fabulous. And what have been your biggest takeaways from this transition? And what would be the lessons that you've learned in terms of going from, conventional medicine into functional medicine that maybe you want to share with everybody?
I think the biggest one, I find that one particularly hard to distill, because given how much you and I like these topics, we could riff for days. So it's always hard to be disciplined and try to distill it. But I think that my main observation is that Western culture and American culture has gotten kind of mechanistic about health. And I don't know exactly how we got there, but that many of us, myself included, sort of tend to think of the body as a machine. And it really is a systems biology issue. It runs like an ecosystem in nature. And so I just found that only about 20% of what I was doing was helping my patients if I picked the right antibiotic for the infection or figured out how to straighten out their broken bone about 1 time in 5. That was what they needed. But 80% of the time, what they needed is for somebody to understand their story and their lifestyle issues and their adrenal or thyroid problems or their need for whole food. And the biggest thing of all I found was just that lifestyle for Americans was the huge issue. And then ultimately, I have found that if they don't address lifestyle, the rest doesn't work at all. The testing and the supplements just get pulled into this sort of abyss of imbalanced or missing lifestyle support. And so now I'm at the point I try to, I'm not perfect, of course, but I try to embody what I recommend. And I'm really honest with people now that if they're not ready to try lifestyle optimization for them, personalized for them, then they might want to just wait to work with me until they're ready, because I don't want them spending their time on testing and supplements if they're not ready to do some lifestyle.
I just love this because so often that's what people want. They want the pill. They want the quick fix. And we want to stay well. And the lifestyle piece is just absolutely critical. And you have something that I like. You call it the 5 Ps with with lifestyle. So maybe go, because I think they're so clever. So why don't you go over what you like, the 5 Ps?
Thank you. Thanks for the opportunity to talk about them. So in terms of attribution, it's the 5 domains of lifestyle from the Institute for Functional Medicine. So it's sort of like stress and stress management, that's peace. And then it's sleep, which is pillow. Food is plants, because plants are so important. And then movement is play. And let's see, what's the 5th? It'll probably pop into my brain while we're going.
It'll come up.
So yeah. So as we delve into them, the thing that people, social
People,
connection,
yes, and that right now with everything where we're so
right,
isolated, I think that's such a huge piece to the puzzle and why so many people are depressed
right,
and unhappy because they've been in a lot more isolation than they're accustomed to. So yeah.
yeah, it's such a poignant, sort of heart-wrenching time, knowing how much pain and suffering magnification is happening, and also how much opportunity is. That I just find it incredibly bittersweet.
That's true. It's
So
true. Yeah.
if you'd asked me a year ago, I would have put the first P, plants and food, first. I'd have been in that sort of Mark Hyman place of saying, without the whole food, things just don't work. They don't get better. And I stand by that. But I think that David Perlmutter's book this last year, Brainwash, I think his observation that if people don't have a state of internal peace to engage all of this, then they're often not even able to take the whole food step. And
Yes.
so if I had to pick the most important of the lifestyle domains, it just seems to me it's having peace of mind. And I'm finding that might be the most misunderstood area. There's this idea that people who are peaceful don't have any troubles, or that life's easy for them. And those of us who've done or familiarized ourselves with mindfulness, or your expertise in happiness teaches us that it's about dealing with life's stresses and struggles and grief and setbacks and flowing with them, being in a state of ease with what Cory Muscara calls this messy thing called life.
It's so true, and I love the book, and I think their point about peace is so poignant because what I found so interesting in going to their lecture actually and reading the book is that you can't learn if you're not you know, even your brain, the way your brain is functioning, if you don't have an inner sense of peace and well-being. And that's what I found in my practice, that just working on someone as a physical therapist, unless things didn't stay and things didn't get better until they got to that definition of happiness, more the inner sense of
Hmm.
peace and well-being. And I don't think, and once people realize that that is equally as important, like you said, as the food they eat, the exercise they do, and that that's really the groundwork. And once they do
Hmm.
it, life flows and things become
Hmm.
miraculous. And I so agree with that. So I think that's really, really wonderful. Let's talk about pillow. What are your secret sauce? Because that's a hard thing. And right now, a lot of people aren't sleeping. And do you have any special tips that you like to share about the pillow and sleep?
I do, for sure. One thing that just comes up over and over and over again is I always talk with people about there being a pretty good chance that there's some adrenal dysfunction, that they're carrying undue release of cortisol into the nighttime when the adrenal production is supposed to shut off and the body's production of melatonin is supposed to kick in. And so, again, I'm always talking with people about, well, take a look at that meditation at night and meditation or mindfulness or yoga anytime during the day. Make sure and be exercising so you have a sort of natural desire for the body to drift into rest. I think the sleep hygiene really gets overlooked. Blue blocking glasses from 6 p.m. onward, not watching action movies, not necessarily consuming political content in the evening, but doing things that are really peaceful and restorative. Having the bedroom be a refuge from sort of all trouble as much as possible. There's certainly some recommendations that the bed only be for sleep or sexual intimacy. I tend to read peaceful things that I like and find kind of an escape at night. So I think it's flexible what people need, but I think many people's room, they inadvertently carry the chaos of our daily challenges into the place they sleep and don't know it.
Yeah, I think it's interesting, all the things you said. But for me, when I was doing some night classes, I had complete insomnia. I could not believe being on the computer at night. So if I'm on after 9 o'clock, truly, it was horrible. I thought, what's going on? And then I realized that it was the blue light, and the other thing is we got a new television set. And the same thing started happening, thinking, what's going on with my sleep? And it was that there was so much more vibrancy, and I guess the light was magnified, that I couldn't go to sleep. So I have to wear those glasses at night. If I don't, it's I'm up. So yes, those are so important. Those are all really, really great tips. And sleep, have you seen that sleep affects every area of people's health?
Mhm. And I think part of what makes me perhaps a more effective or more compassionate physician is just that I've struggled with so many of these things myself.
Mm,
And so much of family practice, what necessitated sleep deprivation. When I had the privilege and blessing of getting to sleep every night, I just, just so, it's just the richest, sweetest, most wonderful feeling to get a good sleep. Oh, and I think all the lifestyle areas surprise many people, but they particularly surprise Americans because we many of us don't realize we've drifted away from the way ancestral people related to their day. And for me, I often, if I need to solve a clinical riddle, I often ask myself, well, if I was a pre-agricultural person, what would be wrong? And so I think that pre-agricultural people gathered when it was light and they slept when it was dark. And they probably got 8 or 9 hours of sleep a night. And they told stories in the evening and relaxed and sang. And so I think a big, good sleep every night. When I witness that in my patients, they just seem at ease in their own skin, and the color of their skin turns rosy and their eyes turn clear and bright and their energy comes back, and then all kinds of systems will start to reboot. So it's one of those deep well springs of vitality that I don't think can be overemphasized. Sleep is so important.
Oh, I so agree. For the bones, for every area of your health, for happiness. And I completely agree. So many
Mhm.
people really, it is a huge issue in our society today. People are not sleeping, or they're going to sleep and waking up in the middle of the night. And there are tricks to the trade. Yeah.
And I don't think that people believe sleep is part of their health. They treat it as sort of, well, I've had these fragmented sleep habits for years, and it just is what it is. My body doesn't need that. So I think it's critical to emphasize perhaps the science. Maybe the science is where it's at for those folks, that we are built to have around 8 or 9 hours of sleep. Not everyone, but without it, then it's like being deprived of whole food or oxygen or social connection or movement. Our bodies are built to sleep, and if we don't, then the software gets hacked.
It's so true. And so often people are like, oh, I only had 3 hours, as though it's a badge of something good. That, oh, yeah, I was out last night. You know, there's a certain generation who, oh, yeah. So I think that's
I do
really,
like it that people can, well, I like it that people can get it some in their bank account. So if they need to write a big check to play with their friends until 3 in the morning, I don't object. I'm happy for them that they have that joy if they've got that big Vitality bank account, or they go to a wedding and dance till 2 in the morning or whatever. I just hope that they don't do that every night.
exactly. And you feel it. You know, to me, there's nothing, when I went from going 11 o'clock at night to 10, I, it was amazing. It really, just that extra hour
Mm-hmm.
was so
Mm-hmm.
restorative. And it's just something that, you know, everyone listening, really focus on your sleep, because it's something that makes all the difference in the world for every aspect of your life. So I'm
Absolutely.
so I'm glad you bring that. Talk about peace. So what's your favorite habit? So if someone says, "Oh, I'm not at peace whatsoever," and they don't do anything for relaxation, and on a scale of 0 to 10, their stress level maybe is 8. What's the first thing that you do with that person?
What I do for both myself and that person is I encourage attending to the breath, no surprise. So I think the trouble is that it can sound clichéic, or it sort of bounces off the person because it's too right there. And so I also add a little mantra. So I did it this morning because I was worried about, as we discussed before you hit record today, I was running a little late. I was embarrassed, and then so I started to develop some monkey mind, and thought, here's this cool professional who's given me her time, and now I'm, you know, running behind. And so I slowed my in breath and my out breath, and as I breathed in, I thought gratitude, and as I breathed out, I thought peace. And so I just breathe in slowly and say grateful, and then I breathe out slowly and I say peaceful. And I have found by doing that over and over again, the slowed breathing calms down the fight or flight tone. It tends to clear out some of whatever negative tapes a lot of us have running. And then I found that the actual words themselves are a reminder that I'm so fortunate that the air is clean, my city is safe, I have a job, I have these fundamental blessings. And I think the gratitude also is that if I am grateful enough to have these blessings, then my cup needs to overflow to others. That's where my energy comes from. And so that little tiny mantra is just this sort of perfect reset moment to moment. And for another person, it might be joy, or it might be something else. But to me, that's where it starts. And then the other practices stack up, the 20 minutes of mindfulness, or the yoga, or the exercise, or getting from 3 jobs down to 2, or I think there's so much housekeeping. But if there isn't that moment to moment sort of realization, oh my gosh, I can reset this now, then I think people just feel fatalistic, that they're just tumbling down the stream of chaos, and they feel out of control. And I think inside they're sort of terrified until they can kind of hit the reset.
What a beautiful practice. And I love the mantra, because we all have our breath with us at every minute. And I think that was so great what you said. You don't wait till the stress builds up. If just throughout the day you're practicing this, bringing in the gratitude, it's so
Hmm.
very helpful, or whatever words you want. I think that's wonderful. And And it really, those little things, that's what I like. It's sort of the little hinge that opens a big door. Just doing that, if people are listening and feeling, stressed out, just doing that one practice can really be profound and life changing. And that's so
Yeah.
fun. And then the other thing that you said, which goes along so much with what I teach in happiness, is that you can't give from a place of empty. And so when you have to fill up yourself before you can give to others, sort of like
Hmm.
put on in the airline, put your mask on before you help them put theirs on. And that was such a good point, that by doing these practices, it's filling you up, and then you're going to be your best self so you can help others. So I think those are really terrific. And I'm sure your patients appreciate hearing those and have reported such good results from those. So thank you.
They're often surprised. They're like, "You're kidding me. This doesn't cost anything and I could do it anytime and I feel so much better."
I think that's what's so special about you and lifestyle medicine, and bringing that to the table with your patients. It's giving them a whole other realm of tools so that they can heal themselves and really stay healed, and their life will be better after seeing you than it was before on so many levels. So I think that's great. I wanted to talk about, because I know that you do some different testing, when people see their conventional doctor, and you do some testing so that it's like test, not guess. I like to look at that. But there's some really helpful testing. And I know a lot of the people listening are interested also in their bone health, but some of this testing is so very helpful, I think. So you want to just delve into some of the testing you do that might be different from what you would have done if you were just a conventional doctor?
Sure, thank you. Thanks for the opportunity. One of my favorite tests for bone density is a urine peptide test that measures bone turnover. And so it's not a substitute for a DEXA scan, but so many women are frustrated by these 2-year intervals between their DEXA tests, and they're intimidated by the radiation of the DEXA scans. And so they are stressed if somebody says, well, your bone density is so low, now you qualify for a yearly DEXA scan. So many of my female patients report to me, oh great, I won the bone density lottery. I've got such low bone density, I can have my bones radiated yearly for my diagnostic information. So they're really stressed. And there's a number of good labs that do it. I use Genova, one of the biggest functional medicine labs in the country, for my urine peptide bone turnover test. And what I mean by it not being a substitute for the DEXA is I don't say to the women that I take care of not to have DEXA scans, but I just let them know that this idea then that I always describe to them that low bone density means that the body is raiding the bones more than it's repleting and restoring them. So it's like the body can't grow the business. It's stealing from the bones, or the bones don't have the factors in place that they need to keep themselves stable and strong. And so these little markers, peptides are 4 and 5 amino acid chains that spill into the urine, and there's a low range and a high range. And if the green zone mid-range comes back for these 2 markers, then whatever I've worked on with that woman often will work for her to have a stable or improved DEXA over time. And I've seen in my practice that stable urine peptide tests tell us we're probably pretty good to go for a better looking, or at least equivalent DEXA to come back. And if there's more than normal in one or both peptides spilling into the urine, then we need to do more before that next DEXA, because we probably haven't stabilized undue bone turnover. So I love that test.
And how often do you usually do that test?
Well, I think it's somewhat arbitrary, but a really broad rule I have seen turn up in functional medicine is that it often takes 3 months or 1 quarter to get into true new steady state. So I don't have data to support that exactly in the bones, but I have 14 years of functional medicine experience to support that, whether it's the adrenal function or the person's nutrition kicking in or thyroid hormone levels being restabilized. I think about 3 months to get to true new homeostasis is pretty darn good rule.
No, that's great. That's what I've seen as well. People
And
that
so
between 3 and 4
I'll
months.
often, yeah,
Yeah.
yeah. So I'll go either 3 or 6 months, just depending on the woman's preference, but those are such shorter intervals than DEXA's every 1 to 2 years. So, and there's no radiation, so we can do as many urine peptide tests as the woman wants, and we could do them quarterly. If this woman feels like I'm way behind the count, I want to do all lifestyle, all supplementation, I've got the fire in the belly, let me add it. They just love it that we can then use this urine peptide testing as a proxy for whether they're turning this around. So I love it when we can offer my patients who are all fired up as much data as they want, whether they're moving the needle, but I also want to limit the footprint of their supplements and their cost and allocate their resources where they belong, just out of respect, and also knowing that their sustainability is going to be better if they build enough of a plan, but that they don't overshoot.
Great. And what about the gut? Because I know you do some really good work as well, because the gut's so important. You know, that's something that I've been talking about for a long time, that if we're not digesting, how are we absorbing our nutrients? And if we have gut issues, that can affect every area of our health, including our bones. So what other testing that do you do specific for the gut?
My, again, just relationship developed with Genova, it's worth giving them credit on the gut testing. They are arguably the sort of leader in developing functional medicine gut metabolism testing. And so there's a number of other good labs, but Genova is a really solid lab to go with. And because I've used Genova for 14 years, I know their tests really well. So I use the Genova GIFX. And the mind-blowing thing to me is that in the early years of the Genova testing, people wanted to know the status of their gut microbiome, their good organisms. And so of the thousands of good organisms that were in there, let me backtrack. So it's a stool test. So here are these folks in there getting the Genova kit from me, and then they're FedExing their poop to North Carolina. So the very first thing I have to do is say, hey, this is this thing you're going to do that's going to pay these huge dividends because it's going to tell us what's happening in the gut. And they say, well, what do you mean by that? And I say, we're going to know what's happening with your beneficial organisms. So if we treat your gut as a town, we're going to know all the different good citizens that live in your town. Do you have enough teachers? Do you have enough law enforcement? Do you have enough telephone line repairmen? Do you have enough moms and kids and dogs and all those things that need to be in your town? Are they there? Are there any people in the town who aren't doing their job? The neutral organisms, you have noxious organisms that are sort of thugs or gangsters? Do you have parasites that are causing trouble? Do you have enough digestive fire via your pancreatic digestive enzymes? Do you have enough do you have undue fat coming out in the stool telling us you don't absorb fat? Do you have short chain fatty acid as fuel for the gut cells? Do you have markers of silent or not so silent inflammation? So it's just a mind-blowing test. And now these beneficial organisms are measured by their presence via DNA, not culture. So we do DNA probes to look for the 20 most prevalent good organisms. So then every single imbalance that shows up has a non-drug remedy. And by the way, we also find yeast overgrowth. The most common thing people worry about when they see me is, do I have overgrowth of candida or yeast? And I say, if it's there, Genova will grow it out and we'll find it. So I've learned that this is a game changer to restore normal gut metabolism. And it's so important. It's kind of like this theme we've been talking about today. If normal gut metabolism isn't restored, then the cornerstone and foundation of their functional medicine house is not on solid footing. And we can spend a lot of time in other arenas and it just doesn't help because the gut is disordered. And then I was so happy last year when one of the experts in functional medicine said that one of the missed things for woman after woman after woman is missed gut dysfunction, imbalanced gut function, poor nutrient assimilation across the gut border, leaky gut, impaired gut barrier integrity, etc. So now I've really shifted in my osteoporosis, osteopenia patients to saying, I would love to have you do this GIFX gut test.
And what have you seen with your osteoporosis, osteopenia women with when they do this test? Have you seen it?
What's really mind-blowing is that every person, not just the bone density patients, but every person has something different wrong. So the variability in what's wrong in the gut is just as different as being tall or short or brown or blue-eyed. There's incredible variability, and it flags this idea in functional medicine that each person's functional medicine plan is built for them like a tailored jacket. And so the people that think they have yeast overgrowth, half of them do and half of them don't. And the people that didn't know that they're missing their pancreatic digestive fire had no idea. The people that have no short chain fatty acids had no idea their fiber content wasn't adequate, or that they didn't have enough organisms to digest the fiber. So there's infinite variability in these gut tests. I've probably looked at well over 1,000 of them now, and they're just as different in their patterns as each person is. So it's really cool, of the hundreds of things that could be wrong, laser targeting for that person. And again, no surprise, then I build their lifestyle plan to, they can't restore gut barrier integrity and nutrient assimilation without stress management, because it's the rest and digest nervous system that runs the gut, not the fight or flight nervous system.
And so what's so interesting is this can apply to anything. It can apply to your bones. It can apply to acne. It can apply to diabetes or blood sugar. I mean, every area of your body, really. If you don't, each person's different. So for one person, it's going to be their bones. But if you have a problem with the gut, it can affect so many different reasons. And a lot of times you
Yeah,
don't have symptoms. It's not as though you're saying, oh, I'm feeling, I have stomach pains or I have diarrhea. It's not necessarily that you have any symptoms, but you can still have dysfunction in the gut. And that's why I think this is so wonderful that you're doing this testing, because it's treatable. That's what I
yeah,
love, that these
yeah.
things, yeah.
I love what you said. It's all so accurate and so spot on. And again, clear the sort of thing a thought leader like you would recognize is that people can be asymptomatic, so they wouldn't know until it occurs to them from themselves, their reading, or the person helping them. They wouldn't know gut metabolism needs to be optimized. And it's worth noting also, I love the testing, but people who develop a positive attitude and work on their happiness and getting their sleep and eating whole food and getting rid of the junk food and comfort food and all that, many of them restore normal gut metabolism without even knowing it.
And so I think that's something to take away. Start at the ground level. All right. All
Yeah.
of these things are so doable. And I think that's what's fun when you tell a patient something to do, like they'll just get more sleep and breathe. And then they come back.
Right.
Right. And
Right.
it's,
Yeah. Yeah. And Margie, I think for transparency, I should say, not only was I sort of late to the party personally, so maybe I can relate more than others, that I didn't take such good care of myself in my 20s. So I know how important it's been for me personally. But as I was trying to develop mastery in functional medicine, I had an undue focus on supplements and tests. I think
mm,
because of my MD training, it's just the way my brain worked. And a lot of my patients got stuck. And I was trying and they were trying. We were all doing our best, but I think I had to pass the 10,000 hour mark in functional medicine for that Gladwell moment. Malcolm Gladwell, he says in Blink, or
oh, I love his
one of his
books.
books, that we have to hit 10,000 hours. Yeah. Yeah, he talks about how we have to hit 10,000 hours before we get these distilled aha moments of sort of deep insight to our area of passion. And so I don't think that I realized I was doing my patients a disservice, a soft, inadvertent disservice, until it hit me that the plans just don't work at all without lifestyle. And so the related thing was that I needed to frame it to people. That's why I picked play as my word for movement, is that if I said to people exercise, they felt like they were getting a prison sentence to go to exercise prison. And I felt like, well, where's your love of movement? How do you move that makes you feel like a kid? And so to me, the mastery component is that if this isn't a sense of spontaneity and joy for people to work at this ground level, a re-engagement with our native delight and being alive, people won't do it, because they won't even see it, that this is re-attaining our birthright as active, engaged beings that delight in our, our connection to this blessing we get to experience every day.
Oh, that's phrased so beautifully, because people oftentimes are like, I know I have to exercise, I'm on the treadmill, and it's a chore and it's miserable for them. So here they are on the treadmill and they're listening to the news maybe, and they're like, I have to do this because I have to exercise. Cortisol is increasing. It's certainly not the type of exercise we're looking for, versus what you're saying, the play, dance, be in your element, have fun. All of that is bringing cortisol, oxytocin, whatever I mean, reducing cortisol, it's bringing in all the good hormones, and it's just such a huge
Yeah.
difference. And there's a million ways you can play, dance, have fun, and get your exercise. So I think
Mm,
that's just really
mm.
terrific that that's something that you tell people, because it's not typical. They're like, okay, the CDC says you have to exercise 30 minutes, whatever it is, and people are like, okay, check that off, I'll get on the treadmill or I'll do whatever, instead of finding an exercise you love. So very important. That's
Yeah.
great. Yeah, that's so important. And so you can continue. There's some other things that you want to share, like your special sauce with lifestyle medicine that you've seen, some takeaways that you want to share with the audience, that they can, just like, I love what you said about the breathing with the mantra. That was so powerful. Anything else?
Mm.
Some special things that you
Thanks.
discovered all these years of working with patients that you want to share with this audience?
Well, maybe I'll share an anecdote and a re-emphasis. So the example for me around this issue then, of each of us making it our own, was that I had seen this concept a year or two ago of high intensity interval training. And if you look at the data on that, on a burst of 1 or 2 minutes per aerobic routine, then you get an extra human growth hormone release to protect muscle mass. You get extra feel good chemicals that the body is made to release, endorphins. And these are significant differences. Nitric oxide, which helps the blood vessels. So these little bursts, and a lot of people have heard of high intensity interval training, or HIIT. And so again, many people who are intimidated by or don't necessarily like their exercise plan think, well, that's not for me. I'm not an Olympic athlete. I'm not a collegiate athlete. And uh, I survived a car accident 15 years ago where my heel got broken, and I was able to get back to running, but I never got back to sprinting the way I did when I was 15. And so I had worked up to my running in the last year or two of feeling like, okay, I can do some intervals. And I found that an interval for me as a 52-year-old runner is not such explosive sprinting that I tear my hamstring. It's going at about 80% of my maximum sort of a explosive capacity. And I'm lucky in Alaska, I get to run in nature, I get to trail run or be on the beach. And so I just open up the throttle to 80% of what feels like my max for 1 minute, 4 times during my 30 to 45-minute run. And then I feel my heart rate get up and it drifts back down. And I have noticed that improves my fitness and my energy and the brightness in my eyes and my sense of ease and joy. Like literally, I get twice as much workout out of 4 1-minute intervals during my run. And to me, then the issue is that it sort of flags everything I'm about and that I recommend, which is that it's got the creativity. I need to figure it out for me. It's got the caution. This is different for me at 52 than when I was 18. It's got joy. What feels good? And most importantly, the world we live in, I find that myself and others feel pushed around by circumstance. We feel that the locus of control is outside of ourselves. So I find that for myself and others, when we take anything in any of the 5 lifestyle domains and we make them ours, then it's sacred. It's our journey. It's our story. And we want to nurture and keep it going, because then we feel like, well, now this is precious. That's just so different, so powerful.
Wow, that really is powerful. And that says a lot, that people can take it, make it their own. And also, I think what you said about control is so important, because what I found, the minute we go to victimhood, or that we're a victim and this has happened to me, versus, you know what, I'm not going to be a victim, because that's the fastest way to unhappiness and I think disease, is to take control, be a victor, and look at solutions and make it your own. So I think that's great. And I like the short bursts. And I've seen, as a physical therapist, you know, sometimes people are doing cardiac for hours, where you can accomplish more in these short bursts, and they're so very effective. So that's a great story. And thank you for sharing that. So we could talk so much, because that's
You
what happened
bet.
last time when I was on your podcast. I enjoyed speaking to you so much, and I loved what you were saying about lifestyle medicine. I said, you have to come on mine, because people need to hear this from someone who's working in the field, living this, teaching it, having patients, and being successful and getting such great results. And so I can't thank you enough. But the interesting thing is that if people want to stay in touch with you, they can. Why don't you tell people how they can get in touch with you, and why don't you fill people in on your website, and also if they want to take a trip to Alaska?
Great. Thank you for the opportunity. So as I've entered this stage in my career where I get to talk to thought leaders like you, which I get to meet my tribe every week, every Thursday feels like Christmas. So I just stay all lit up. We also then created what I think of as a state-of-the-art website with some really good support. And so that's seaworthymed.com. And we have,
SEA. Well, we'll have it in the links, but it's SEA
yes,
worthy.
like the
Okay.
ocean.
Yeah. Okay.
Like a boat would be seaworthy, seaworthymed.com. And so we have a weekly podcast and blog. And I was lucky enough to interview the father of functional medicine the other day, Jeff Bland. So that was an incredible privilege. And that conversation was really a blast, because he's influenced me for 14 years, but he didn't know it. So I got to talk with him about that. and
Wow.
and then the way we have the, again, really thankful and benefit from having a great editor for the blog. So they have links. So when you're, from when I had the privilege of interviewing you, your blog transcription will have links to the things that you care about and that you reference, so people can drill down for content if they like to read and do blogs, and that's all on seaworthymed.com. And we built a system to work with anybody in Alaska, so they can establish with us remotely. They have a primary care doc. And inside or outside of Alaska, if people don't live in Homer where I live, they just have their primary care doc clear them to work with me, basically say, I know this person, I'm their primary care doc, they're good to go to do 2 years of functional medicine, and it's just gentle and safe lifestyle and supplementation, they're good to go. And then they can come in from outside of Alaska, have a fun visit to Homer. It's a blast to visit here. We have humpback whales, sea otters, beauty, salmon, mountains, ocean, good food, you name it. It's a great destination, Alaska. In winter, they can go skiing. Winter's tougher and scarier, so I wouldn't necessarily recommend visiting in winter, but if the people are really hardy, they could. But once COVID-19 lifts enough, people could come see me just once, literally once. And then legally, they're an Alaskan patient. And I can follow up with them in perpetuity in Dubai, Cleveland, Cincinnati, Montana, you name it. They're an Alaskan patient after just one visit. So if they love the way we work, they can see me once and they're a seaworthy patient forever. So it's just a really exciting time.
It really is, because you can spread what, you know, I think it's very important when people click with the person they're working with. I think that's huge. And I think if you don't feel that way with your provider, then it's time to change who you're seeing, because you want to have that kind of relationship. And so if he has to be coming to Alaska, but to me, that sounds really wonderful. I wanted to go to Alaska anyway. So to me, hey, you can go on a trip, have the doctor's visit, and then you don't have to. It's just a win-win situation. Right now, the thought of going to Alaska sounds absolutely amazing when we've been sort of cooped up. So I can't even imagine being in
Yeah,
Alaska right now.
yeah, and it is a blast, and people report that it's great. We think next summer or summer of 2022 at the latest, we'll also have these, we'll set aside 1 week each month June, July, and August, and we'll do a cohort of 6 to 15 people who come and learn from each other and from us and cook with us. We're hoping to build a teaching kitchen in our new clinic. And we think that they can do a medical vacation, and they spend about 3 days with us, like half to 2/3 of each day, lectures, learning about one another's issues and what functional medicine analysis is and how that illuminates each person's issues. So there's just an unlimited number of ways for this to be better and better all the time.
Oh, it's so great. Well, I can't thank you enough. And I love the work you do. And I've seen in my life, that's why I'm so passionate and love working with functional medicine physicians, because, and what I like also with you, though, you add this other piece that I believe in the happiness and the peacefulness and the reducing stress. That whole other piece is part of you. So you combine the best of functional medicine plus this other piece that I think is really critical to healing. So this has just been such a pleasure. And I look forward to staying in touch with you. And I hope to come to Alaska one of these days. Because it's so...
Well, it'll be great. We'll what's Tom Bodette say? We'll leave the light on for you. We've got a guest room. We don't get enough visitors, so you've got a place to stay if you need it. And if I can pass along a kudos as we wrap up, thank you for having me. And you also have the capacity to help people across state borders. And I did recommend to a person with bone density issues who's a very educated customer that she considered working with you the other day. And so it's worth
Oh,
flagging, I think, as we wrap up, that we both offer a similar way of being able to reach out to anyone. And I hope that she sort of leverages that access that she has to your expertise. So thanks a
oh
million. It's
well,
been
thank
really
you
delightful.
so much. Thank you. And anyway, thanks again. And hopefully I know we'll keep in touch. So thank you and see you soon.
Great.
I hope you've enjoyed today's interview with Dr. Rob as much as I have, and see the important role our lifestyle plays in our health. I hope you have some takeaways that you can put into your life, and all the links will be in the show notes. So bye for now, and I look forward to seeing you on the next episode.